Good day. I'm Roger Dmochowski. On behalf of my co-authors, I'd like to present our findings. These are my disclosures. I am self-funded for this meeting. Our work and paper is entitled Increased Risk of Incident Dementia Following Use of Anticholinergic Agents, a meta-analysis, and again, I'm presenting this on behalf of my co-authors who are listed on this slide. So there's an accumulating body of evidence and knowledge related to anticholinergic, antimuscarinic use and cognitive impairment. We use quite a number of antimuscarinic drugs who are obviously anticholinergic in general class for the treatment of our conditions, including overactive bladder. There's a growing body of evidence that now strongly suggests that anticholinergic exposure is associated with an increased risk of dementia. And importantly, the higher temporal cumulative exposure to anticholinergics is also associated with an increased risk of dementia. We know that acetylcholine is widely distributed in the central nervous system and has a significant role in learning and memory. And there are now guidelines suggesting limiting the use of these agents, especially in patients at risk. Hence the indications and hypothesis of this study. So our objectives of this study were to essentially assess a longer-term impact that's defined as 3 or greater months of exposure to anticholinergic and antimuscarinic drugs as a class on the risk of a variety of central nervous system issues such as incident dementia, mild cognitive impairment, and change in cognitive function. And specifically, if possible, to break out the effect of anticholinergic, antimuscarinic agents that are used in our specialty for the treatment of overactive bladder. Our methods were to use a meta-analytic model and perform a systematic literature review, surveying the databases including PubMed, Embase, and the Cochrane Library till August 8, 2019. Overall, the impact of anticholinergic agents used for greater than 3 months were evaluated, and these must have been associated with reports of either dementia or cognitive dysfunction in adult patients. All studies had to be a randomized controlled trial or case control study or cohort study, and there should be an adequate description of methods so that the validity of the study's conclusions should be determined. And again, all papers should have been a primary publication. A random effects model utilizing meta-analytic methods was utilized with the confidence interval stated as noted. This is the PRISMA diagram when it indicates the breakdown of articles retrieved. As you can see, quite a large number were retrieved. However, after screening and eligibility as well as determination of validity was determined, overall 21 papers reached the criteria to be included as a qualitative synthesis, and 6 papers reached the criteria to be included as quantitative analytic determinations. This is the odds ratio chart demonstrating that the studies have a strong definitive indication of an increased risk with anticholinergic exposure for the risk of incident dementia. And as you can see, of the 2 studies that have specifically evaluated anticholinergics for overactive bladder, both reported an increased risk of dementia at 3 or more months greater exposure, with the odds ratios ranging from 1.2 to 1.6, again implying the significant potential impact. So we'll conclude this by saying that, consistent with prior reports, longer-term use of anticholinergic agents is associated with an incident risk of dementia at approximately 46% as compared to patients who were non-use patients, and this does suggest a risk of dependent duration on exposure. We don't yet know what that time to incident dementia is, however. This increased risk of dementia was also associated with anticholinergic drugs used specifically for overactive bladder, hence the importance of this topic for practitioners in our field and discipline. Obviously, the patient safety indications for this study are that the risk of developing dementia should be carefully discussed with patients considering these classes of agents for treatment of the lower urinary tract symptoms. Thank you very much.